even after the after the medication, I wasn't able to do that stuff. Running don't feel the same. I don't feel the same endorphins I had. I don't feel the same pleasure from that.
Hi, I'm Dr. Joseph Witt-Doering. It's my pleasure to be joined by Jaden here today. Jaden suffers from PSSD. He's kindly agreed to share his experience with us so we can kind of learn from him about the condition and what it's been like living with it. Jaden, I'm just going to hand it over to you first. I mean, people don't know you. Just tell us a little bit about yourself.
From Michigan. But I've been very athletic my entire life. During the COVID lockdowns, I was dealing with depression from the isolation and the circumstances, and things went south quick for me. And I guess that's just a little bit about me. Of course, there's a lot more in my life, but that's just
Are you working? Are you in school, or were you working, or were you in school before all of this happened?
No. I was working. I was traveling with the family business, and everything was going well until COVID happened. Due to the business, it's a carnival business, so due to that, we weren't able to operate, and so we had to bunker down in a location south of San Antonio called Poteet, Texas, and it was like a fairgrounds area. And I was living there with my father in a trailer. I had neighbors who were H-2B workers from Mexico, and a lot of them got sent home. A lot of my buddies I worked with got sent home, and I was only part of this family business for about 6 months. I grew up outside of the carnival life. I went to school, went to high school. So I wasn't always traveling on the road, but I wanted to, get to know my father. And so I decided to go on the road, and the circumstances and everything, and the combination of the lockdowns and the depression, I guess, I was enduring due to that, made me, acceptable, or what do you say? How do you say that? Vulnerable to being, a bit peer pressured by my father to go see a doctor, and we didn't know the difference at the time between a psychologist and a psychiatrist, and we went right to the psychiatrist, and he was a guy with a private practice, an older guy, and it was only a few brief appointments with him, and very short, maybe probably 10, 15 minutes, and out the door. There really wasn't much to talk about. And I'd tell him the things that were making me upset, just being away from home, not having any friends at the time due to where I was staying. I'm from Michigan. I was in some other place. So I just and it's hard to talk about this in order, but he was presenting with me some symptoms of medical issues during my appointments that should have been red flags. He was falling asleep at these appointments, dozing off, writing notes. It was really concerning, and I stepped out of the room one time to tell my father, I don't think the doctor's okay. He's zoning in and out, and he's he eventually snapped out of it, whatever spell he was under. He was also, a Vietnam veteran on a lot of medications due to medical issues. So I think
your dad
no,
the psychiatrist.
Yeah, psychiatrist was on many medications, and I think that was one of the reasons he got me to take a really ridiculous medication for depression was due to his own experiences and sharing and opening up about his medical issues, and kind of I don't know. I just felt like I was just so trusting in that moment, and also vulnerable too, just wanting any relief from, the depression I was going through at the time. Okay. And he recommended me a 120 milligram injection of a drug called Perseris, which is risperidone.
Yeah.
I had horrible dystonic reaction the first day, and it lasted like 2 days. I'd like go to the ER, and they gave me like Benadryl through an IV, which kind of helped. And then they sent me home with that. Didn't really do much for me.
Jaden, can I interrupt you? So,
yeah.
was that the first medication he started you on, or were
Yeah,
there a
okay.
couple
So there
others?
was
Yeah.
okay. Yeah, there were like a cocktail of 5. It was like Effexor, Risperdal tablets, Wellbutrin, and Xanax, and then like one other one. But I didn't take these things. I was staying with my father and I had my own room in the trailer. He had his own room, and there, he wanted to make sure I was taking my pills, but I wouldn't take the pills. I would just hide them in a suitcase because I was like, I ain't taking 5 different pills. Like, this is crazy to me. This doesn't sound normal.
And how long were you meeting with this psychiatrist? Like, how many meetings did you have before you had 5 scripts? Was this over like 6 months or a year or something like that?
No, it was a very short time. Like, it was like, I mean, I think he prescribed the pills a lot sooner. Like, it might have been like the second appointment, and then it was like the third follow-up, which is like where I came to him and I was just saying, like, I don't want to, like, I'm not interested in taking the pills. And he's like, well, you got to do something. You got to do something. Otherwise, you're going to get worse. You're going to spend the rest of your life with depression, giving me, which it wasn't true. I would have pulled myself up by the bootstraps given, a different environment. But
wait, so this happened over like maybe 2 months, maybe like something like that, 3 follow-ups, something like that, or maybe a bit longer.
Because it happened in July of 2020. I'm trying to think of like, July, August, September, December. I think it might have been maybe like 2 months. Maybe it could have been like 2 months. And then
usually, well, I was going to say, usually when you get on, like, were you psychotic? Were you having hallucinations and paranoia at any point?
No. Yeah, that's the scary part, and that's what traumatized me is that I was prescribed a medication off label for a dose, for like a horse. 120 milligrams is really high for somebody who doesn't have a tolerance, and I guess I'm allergic. I didn't know I was also allergic, but
yeah. Well, let me just say, I mean, so for those who are going to watch this who are not aware of it, so Perseris is the brand name for a long-acting injectable version of a drug called risperidone, where you kind of load someone up with a full month's worth of medication, on one day, and then it creates like usually it's given into like the shoulder, and it creates like a clot in there essentially, which gradually dissolves over the space of a month. And to get the kind of the daily dosage of it, of what it would be orally, you just kind of divide it by the days. So 120 milligrams is, that would be about 40. So 4, sorry. So that would be about 4 milligrams a day. So that would be the maximum, maximum recommended dose of Risperdal, a drug typically used for psychosis and schizophrenia or severe bipolar disorder. And the thing with the long-acting injectables as well is they're meant for patients who have difficulty taking the medication because they have very severe psychosis, and they may go into bouts of delusions or paranoia, and you want to kind of just get the drug in there while it's kind of smooth seas, because you don't know whether they're going to go on and off, and essentially. But that doesn't sound like it was you. It didn't sound like you had some kind of treatment-resistant schizophrenia. No, where you were in and out of hospital several times, and people were just trying to stabilize you, right?
Yeah, I mean, I'd understand it in circumstances like that, but it doesn't justify, just starting off with like the highest dose, no tolerance. I mean, he like I think we had the discussion where I was telling him like I wasn't taking the medications, and that's one of the reasons why he was like, well, if you don't want to take the medications, I have a sample injection we can give you for free, the first one, and
tell us about your dystonic reaction, because that's kind of a horrific thing to happen. Yeah, what was that like?
That was terrifying. Like, I felt out of my. I mean, I kind of remember it vividly. Sorry, it's just like not being able to breathe at all.
Yeah.
It was just so weird. I mean, it was such a traumatizing experience. And then after that, like, I didn't know at the time, like, what I was really, really experiencing. I was just trying to stay cool, telling myself everything's going to be fine. And, you know, my father at the time too was, you know, everybody was telling me, my mom too on the phone, was just saying that it's gonna go away, everything's gonna be fine. And I was just trusting in that process. But things over time kind of got worse for me due to that injection. I developed like I guess you know, akathisia. I was never officially diagnosed, but like not being able to sit still. It wasn't anxiety. Like, I've always been like a super chill person, and I wasn't able to, like, I was pacing. I couldn't sit down for breakfast.
Well, let me ask you this, Jaden. Did you try the oral medication first?
No.
Or did you just go straight to it? Okay.
Yeah.
So, I mean, that's kind of malpractice what happened, because, you know, right in the drug label, it says that before you get put on, you know, one of these long-acting medications, because really, like, if you have an adverse reaction to that, the only thing you could potentially do is go to a hospital and find a general surgeon, and they cut a chunk out of your shoulder to remove the clot. I mean, that is...
Yeah, that's what I wanted. I didn't. I would have taken that opportunity. Oh, it wasn't in my shoulder, by the way. It was like one of my flanks. I can't remember, like my right flank.
Oh, interesting. Yeah. Okay. So maybe it would have been different, but that's a possibility. I've heard of them doing that before. But usually, what you're meant to do is give someone, you know, maybe like a week or two of the oral medication just to make sure they don't have an
4 milligrams. At 4 milligrams too, and like not this.
Yeah.
I mean. But I feel like you would have to work your way up to 4 milligrams. Like, I mean, I know there's other injections too of risperidone, Risperdal injections that are also long acting, but they're like 25 milligrams, and they're not, and it's not like 120. Like, for somebody my age, like my weight, my size, like, I mean, I'm 6'4". I'm a skinny guy, but like,
yeah, you start someone on like, you know, usually you start someone on like 1 milligram of Risperdal a day, you know, would be a normal starting dose for someone, not 4 milligrams. And so that's, malpractice occurred because that is really, really bad, because they didn't test. I mean, if you think about it, like, bad things happen to you. Yeah. You had the akathisia and the dystonia, but, you know, there's cardiac problems with Risperdal as well as there are with all other kind of antipsychotics. And so it could have caused like a seizure, or could have caused a cardiac problem as well, and would have been really, really difficult to treat you. So, yeah, I mean, what happened was like very, very bad.
I wouldn't say it's common either. I don't think most doctors go to that, but I just think due to the circumstances. I mean, I think back at it now, and I see all the red flags, but I didn't see it then. Like, the very old guy, falling asleep at my appointments, and then like also other things, you know, I wasn't aware of. I didn't know medications had long side effects or severe side effects like that. I just kind of assumed everything was. I thought we were very technologically savvy in medicine, and I guess it's not really like that in reality. At this time, I mean, it's getting better, but it's far from perfect.
Yeah.
So,
well, God, that is awful. I'm so sorry. That is the experience that you had. Walk us forward from there. Tell us the rest of the story.
So we had a follow-up appointment. It was like in August. You know, August 1st. The medicine supposedly out of my system, but I mean, I didn't feel like it was. I was having all kinds of problems. I was telling him, like, I don't feel right. I feel like, and I think around this time too, I was having some minor sexual dysfunction from the medication as well. But then he was just telling me everything was anxiety. It was all anxiety. I need to get over it. I'm the doctor. Listen to me. It seemed like he had, you know, it's on his high horse at that appointment. And my mother was on the phone too at that time, and she recalls everything. And I think we were just all trusting him because we all wanted the best outcome for me, and I trusted him again for a second time, which was a big mistake because I went on I went on Lexapro. It's like 10 milligrams and Xanax 3 times a day, and I took that combo for 22 days, and that's when I really developed. I mean, the onset of the sexual dysfunction was like boom, like first day, and then like the problems persisted after I discontinued. And I guess I forgot. I guess I got to walk back a little bit, but I forgot to mention that the headache problem that I developed on the risperidone that was like on and off, and eventually became just persistent, just like the whole like genital numbness thing that people suffer with, guys suffer with, and instead of numbness behind my head, I developed like a neuralgia, like a type of headache, persistent, wouldn't go away. I've never had headaches like ever. I mean, my mom and my sister suffered with migraines, but I've never been one to have typically any problems with headaches. I mean, I thought people with headaches were babies. I guess I have more empathy now. I mean, that's terrible that I thought that way, but I just didn't know. And it was just, it was like one thing after another. I don't know. I felt like it got like obliterated.
So you ended up on the so you're on Perseris. I guess you essentially ride that month out. I guess the dystonia eventually resolves. How long did it take for the dystonia to resolve? Like a couple of weeks or a couple of days?
Weird symptoms were like so much adrenaline. I couldn't look at my phone. I couldn't watch TV. It was just overstimulating. Like, I don't know if that was like a symptom of the dystonic reaction or something else happening due to the mechanisms of the drug. I just felt like I was just staring. I remember just staring at a clock, like I was like going insane. But I was like every single day I was just waiting for the time because I was just like this is gonna pass. This is gonna pass. And I wasn't able to scroll online and look up side effects. Like I was just like, this is gonna pass.
Oh my god.
It was a battle. I just didn't have to go to the hospital. I didn't have to go to the ER after the 2 times that I went.
Okay. And so tell us. So it sounds like you thought you were developing sexual dysfunction when you were on the Perseris, and then when you started taking Lexapro, things kind of turned up a notch. Can you tell us a little bit about what you noticed after initiating Lexapro?
I have no idea what it was really doing. And combined with the Xanax, I didn't know like what was working or what wasn't working. I just knew I have absolute, I don't know, just complete genital numbness, I guess, like just kind of like. And then I told my father about it, and he thought it was like funny and like it was like a joke. And I'm like, this is nuts. Like I'm 20 years old, and it's 20 years old at the time, 23 now. But being 20 years old with those symptoms, and I've never had that before, not even with depression, it was just kind of like, it was traumatizing. I don't know. It just felt like stabbed in the heart and betrayed. Like I just wasn't expecting that to be a possibility. And I wasn't told either that there'd be sexual dysfunction. I wasn't told really anything, and just other than like maybe like dry mouth and headache, and you're going to be fine.
How long did he say that you were going to be on the Xanax for?
There wasn't a particular time. Like I just remember like I had like 90 pills, and I never took all of them. Eventually I got rid of the medication and the Lexapro. I think it was helping with like the Xanax was helping with like the inability to sit still, but it wasn't like, I was just so scared. I can't do this. Like I just couldn't do it. Maybe I should, and I understand like in severe cases, like that was a severe case. Like imagine somebody who's coming to seek treatment and has those symptoms just naturally occurring. Like everyone's going to want to help that person, but for me, due to how it happened to me, like I was just like, no, I can't go back and get bit by the same dog. Like I don't want to go down the rabbit hole again.
Yeah, and I mean, it sounds like when you were kind of complaining about the sexual dysfunction, he was saying that it's just anxiety. You know, this is just a young man with performance anxiety who, you know, is just too in his head, and that was just like completely written off. So how long were you on Lexapro, all up?
22 days.
22 days. And did the sexual dysfunction, I mean, has it endured since that time?
Yeah. You know, it's gotten like a little better, not completely. You know, I still have issues where, I describe it as like a circuit, like flickering on and off. Like there's some days where it's just like things seem to work, you know, for acutely, but it's not the same. It is not the same of what I had before, which was so much better. I mean, the pleasure I had, you know, from experiences and just, you know, self pleasure was, I mean, thinking about it now, I mean, that was out of this world compared to what it is now, which is just like a sneeze. I mean, it's just like, how is that even like possible? But I guess, you know, there's other conditions out there that are similar but not the same, that mimic the same symptoms. So,
but there's really not, you know, is the thing. And, you know, because they say it's, well, this is what they tell people, you know, they're just like, oh, it could be anxiety, you know, it could be in your head, you know, and then it's like, well, he never really had it before. He's complaining of genital anesthesia now. He has muted orgasms, you know, where the intensity has gone down. Those are not symptoms of sexual dysfunction associated with anxiety.
No, it's not typically. I think for the majority of people, that's not the case.
No, for hardly anyone, you know, that's the case. You know, people with depression, they still have orgasms, you know, normal orgasms.
Intimacy, or they want to seek out a partner or go out on dates, or they want to do things. They're just depressed, you know, and it's not the same, you know, it's not the same per individual, but I think for the majority of people, that's the circumstances. I mean, that's just, I don't think it's, I see people, you know, from doing awareness, you know, and I think the Twitter sphere is a small sphere and doesn't speak for everybody who's out there who's a doctor practicing medicine, but I see people saying, well, that's, you know, those prevalence studies of depression show higher rates of low libido and sexual dysfunction. Like, okay, but that doesn't speak for everybody, and I think that's just like a very narrow study. Like there has to be flaws.
I mean, like I get low libido, but the thing is, it's like a mix, you know. Like I spend most of my career talking to depressed people, and some of them are less interested in sex. You know, some of them have such severe anxiety that, you know, they become like lethargic and they're not that interested in it. But others, even when they're depressed, I mean, sex is like a escape for them. Masturbation is an escape for them. It's something that they do, which is like almost like a life raft of like pleasure that they hang on to. It's like the thing that works. So it's not like it's this.
Yeah, it was my form of medication. I got to be honest. You know, if I was stressed, it was something I did. You know, if I wanted to, if I was on a date, something I wanted to experience, like, and for that to just kind of be like all of a sudden be taken away, like it's kind of crazy. It's just,
and that's not unusual. I mean, I've seen statistics, you know, and I know, you know, young men / men just in general. I mean, you know, masturbation is frequently just a way of stress relief. You know, when people are anxious and when people are depressed, you know, it is very, very normal.
Yeah.
And so to say that it's due to the mental illness is
it's too simplistic.
It's way too simplistic. And then the other thing that when people have sexual dysfunction is from cardiovascular disease, you know, or it's from taking other medications or drugs. And if that doesn't fit you, you know, like cardiovascular disease, we're talking about people 40 and above who have heart disease. And then even in them, there's no problems with your orgasm. It's more problems with blood flow and maintaining an erection because the vessels become damaged. And so if that's not you and you're not, you know, taking some other drugs that could influence that. I mean, were you taking any other medications or?
No. I was never on psych medications. I mean, like 7th grade, I took Vyvanse for like a very small period, but it never caused problems. Like growing up, like totally fine.
Yeah. So, well, actually, let's do this because I think PSSD is really interesting. There's a lot of different symptoms in there. So after you developed the sexual dysfunction from the Lexapro, and then it sounds like you stopped it after like 28 days, right, or like a month or something like that. Not long. Is that right? It was about
20 days. Yeah.
Yeah. And so, what was the constellation of symptoms that you had after coming off the Lexapro? So it sounds like there was some genital numbing, but what else was going on? Because sometimes people with PSSD, they kind of report like a whole range of things.
It's crazy. I mean, this is why we all I feel like, obliterated. It's just because of, I mean, I'd say some of the symptoms overlap with long COVID, but it isn't long COVID. I didn't get COVID until I went on a trip to Mexico after a surgery I had. So, I did, anhedonia, inability to cry, like emotional blunting, and it slowly got better over time a little bit. But then, like, I feel like the trauma too has made my numbness a lot worse. Like, my ability to feel emotions deeper. Like, I just feel like maybe it's my way of coping, but I just don't feel like I can, like I want to, let relieve myself with tears. Like, I just don't. I don't know how to describe that well, but
is it kind of like
a very emotional person, and I don't feel like I'm as emotional.
Okay.
And some things did persist. Like, I feel like brain fog is one of those things that I have a hard time working through. Mm-hmm. That's a difficult problem that's persisted and stayed. I also think that some of these symptoms may also be, and I'm just speculating, I mean, but like a trauma response to everything, like feeling out of my body, not feeling present, like, and then I have to they say to practice, like, I've heard therapists say this, but practice grounding, like being present in the moment. Like, it makes sense, but it's like hard to do that given all the things that bother me. And
sure, yeah. And you bring up a good point, especially about the emotional numbing and the blunting, because I imagine this is many people with PSSD may find themselves in a similar situation where, part of the syndrome really is like this emotional blunting and numbing, but a common symptoms in a trauma response are also kind of this type of shock where you just don't feel things anymore because you're faced with the horror of, oh shit, have I sustained like a neurological injury? Am I ever going to be the same again? I've been betrayed, I've lost these things, and people deal with severe trauma in different ways. And one of them is this kind of dissociated type, blunted, kind of withdrawn thing. It's like protective in a way because it's so kind of horrific what's happened. And so you get this combination of, a drug injury, which can do that on its own, but then also the trauma, just like you said, the trauma also kind of pulls you out of, I guess your ability to kind of connect with other people and things like that. Because if you're going through what you're going through, it's very hard to be interested in the things that I guess you'd say happy people are interested in. You're just like, how can I relate to those things?
Yeah, I feel like an old man. Like, I'm just staring at my generation all the time. Like, those young people, I don't know. I still, like, I could still relate because it wasn't too long ago that I was healthy. I was one of those people, but on this side of the fence, yeah, I do feel a bit like,
jaded,
like, I can't relate to most people. Like, I just don't.
Yeah, no. You see like happy people and their lives, and you're just like, I wonder what that's like, or some people, they come from a place where it's like they used to be like optimistic about the world, and then it's just like this has been the thing that's really like shattered that. It's just like, actually there's like disaster lurking around every corner, and if you're unlucky, it can happen to anyone, really. It really does age people. I think feeling like an old man is like a good way to put it, because it's like that. I don't know, maybe it's like losing a form of like innocence, especially. I mean, I don't know what your life was like before of this. I mean, there may have been terrible things going on, but for a lot of people, when something this bad happens to them, it's just like their whole worldview changes. It's quite a lot.
Mine totally.
Yeah.
I feel like half the person I was, but I've also learned a lot through the whole process, and maybe I've grown some. I mean, I don't want to be completely pessimistic, but I mean, if anything good came out of it, I mean, it's been able to speak up about it, and I guess kind of like pursue hope and
Well, it does sound like there is a lot to be hopeful for, because it does sound like things have improved over the last 3 years. Can you tell us about like the trajectory of these symptoms over the last 3 years, how they've kind of come and gone, and where you're at today? Like, how bad were they at the start, and kind of where are they now?
So some things have gotten better since the start. Like, I can't say it's all completely gone downhill, but I've sort of just like flatlined. I haven't got better. I haven't really gotten worse. The headache, I had a occipital nerve decompression in San Francisco. I had bilateral excision of multiple peripheral nerves, and so part of my head is numb. It does help a little bit with the burning pain that I was dealing with at neuralgia. The sexual dysfunction, it seems like, I've tried medication since, like Wellbutrin. I gave it a shot that worked for like 2 months, stopped working. I gave Vyvanse a shot. It worked okay. I gave Adderall a shot. Too many physical side effects, like just feeling dehydrated. I mean, it did help. I mean, these things, like, I don't know, there must be some kind of also dopaminergic variable, the PSSD in some cases. I don't know if it's all cases, but it seems like it plays a small role for me, but it isn't like, I don't know. It hasn't completely, like, if I stop taking the medication, I don't get like better or anything. Like, I only benefit when I take the medication. Mm-hmm. The benefits over time too kind of fade away. That's one of the problems I have with those medications, the Vyvanse, and I guess all three of those medications.
Okay.
So as of for right now, I think they're like good tools for me to use, but like I just put them in the toolbox. Too many side effects. Too many.
What keeps you going during all of this? I mean, this is going to be no surprise to you, but people with PSSD and who go through this kind of stuff, they can become suicidal, things like that, and it's often like, life can be a struggle sometimes. What keeps you going? 3 years down the line.
I think it's just the memories I've had and I've made, and when I was healthy, it's like I just want that again. Like, I lived a great life. It was beautiful. Everything that even like, I just have a lot of hope for getting that back one day, and I think it's possible. I don't see why it isn't possible. And especially, I just don't think the trajectory always has to be like a downward incline. Like, I think it can go anywhere, and especially with like the developments in medicine, I think it can be like that too. So there's things to look forward to, and I think that's what keeps me going. I think PSSD Network was great for me to help out with a little bit. Doing in the beginning, doing awareness with everybody, it provided some sense of purpose and community, and helped me to be able to find others to relate to, and not feeling less alone. So I think that's a great thing. People, I think, do need that, who are suffering, is community, because it can feel really lonely when, especially like you're a young person and like no one else can understand. So
no. Yeah, the community, I think, has been a total lifeline, because it's so isolating. Do you feel like your family has been able to come around and they kind of they understand what's happened to you now?
Yeah, yeah. My mom in particular, she's really great and understands everything I'm going through and goes to bat for me all the time. Everyone's responses, like friends and family, like everyone gets it. No one really truly understands what I'm dealing with, but I think everybody wants me to get better, and no one's invalidating what I'm going through, and everyone believes what I'm going through because it just isn't nothing like me. Like this is nothing like who I was. I'm not just making this stuff up for attention. Like I'm debilitated by so many different things, and it's so surreal, but it just, like I'm not the only one. So that's another thing is like there are other people out there going through very similar problems and had similar experiences. So it makes me hopeful that in the future, due to that, like also like, again, it'll like these things could be solved. I don't know. I just don't think this is forever.
Yeah. No, and I think some of these things, at least from what I've seen on the forums and stuff, they just resolve, even without any intervention or medication, just time. And, the fact that you're 23 and you're, really the nervous system, especially in men, doesn't fully mature until the late 20s or 30s. So it's still in this kind of process of reorganization and such. So I really do think there's a lot to be hopeful for, even without some kind of intervention, just where you are. Something I'm interested in is, how did your relationship end with that first psychiatrist that kind of essentially like obliterated you? What was the end of that relationship like?
I ghosted him. I left, we left bad reviews, my sister and I, and because it impacted her too. I mean, she had to see her brother go through like terrible things, and it was, the akathisia, whatever, the movement, just not being able to sit still, the head pain, just she didn't see the brother she had before. So like, it's been traumatizing for my entire family. It didn't just impact me, but impacted everybody, friends too. And, so I never got, well, we tried to get my medical records back from him. We tried to request, to see what he wrote, and we never got anything back. So, and since then we never tried to reach back out. So,
sure,
we just weren't. I don't know. We're just trying to move on. But I don't even know if he's, honestly, like I don't know if he's alive. I don't know. I mean, he's an older guy. Due to COVID happening, I don't know if he would have survived that. Like I have no idea. So even if I wanted to, like sue or something, what's the point? I don't know. Like also, like I want to forgive him, but it's kind of it's a challenge. It's just a challenge. But yeah, I don't know. It's just kind of hard because there's no amount of money that's gonna make me happy. I want my health back.
Yeah. So. Yeah, exactly. No, it's really confusing, and I just want to I don't know what I would do in a similar situation, but it's you're clearly just a very compassionate person and a kind person as well, because someone has really wronged you, and the first thing that kind of comes to your mind is, well, no, it's not the first thing. It's just like, I'll probably need to forgive him to move past this. There needs to be this kind of this side to the healing, which I think just really speaks to just your kindness and maturity, which is just great to hear. I don't know if all people would be able to feel like that. But the other thing I wanted to ask you about is, based on what had happened to you, I was just wondering, can you just comment on like, what do you wish would have happened, when you were, when COVID hit, work slowed down, you're in the middle of nowhere, depression is real, feeling terrible and anxious is real. Your dad saw something that he was worried about and he wanted to help you. What do you wish would have happened back then?
I think it would have been nice to have my father kind of like, I think he was kind of another a factor into this, but open up more with me about what exactly were the things I was struggling with. What were the things that were making me depressed? Being there with him in a place where I had no friends, it was very frustrating. I mean, I think everybody was impacted by it. I mean, listening to other people, I think a lot of people were depressed, not being able to go out anywhere. Everybody at that time was going through rough times, and I unfortunately just got caught in the crossfire of everything. And but I think therapy would have been better for me too. Changing my environment. I mean, there's so many different things like I think of that could have been done to change what happened. I mean, there was a time I wanted to go home. I called my mother and I said, I want to come home. I don't want to be here anymore because it's really depressing. I'm stuck in the trailer with nothing to do, nobody to talk to. And I just want to be by my friends. And I wasn't unfortunately able to do that. And that's what kind of led to I think a further escalation of my depression at the time. But I know if I just think, I don't like to think of the what ifs, but I know if I went back home, I probably would have been in a way better position than I am. And probably would have been getting, the therapy I needed. And I wouldn't have, the doctors here have been amazing. I mean, it's crazy how I literally had one bad doctor in my entire life. I've never been a doctor person. I've never been a hospital person. And it just took one bad doctor to ruin it all for me. So, it's just everyone here has been different. And so, I would have gotten better help here.
And when you saw that, the first doc, looking back on it, was there any therapy there or any kind of Jaden, can you tell me about what's going on in your life? Let's catch up with your dad. Let's try and kind of troubleshoot what's going on. Tell me about maybe, are you exercising? Are you, what's your diet like? What are the important relationships like for you? Were those things tried by the psychiatrist?
No, not really. I mean, he would talk about these things, but they weren't they weren't possible to do. It's you should go to the college in downtown San Antonio, and it's I can't do. I have no car. My car's in here. It's at home in Michigan. Yeah. And with Dad, we only had one truck. I can't. My dad's doing business work there. It's a carnival business. We have equipment out there. There's a bunch of things to do, things to repair, things to work on, maintenance, while we were waiting for the lockdowns to end. And so he didn't really understand that. I don't think he understood that just because I maybe assumed I had a ton of money, I could just do these things, but no, that wasn't the circumstances for me. No, I didn't have that help. No one said oh, hey, we'll get somebody to bring your car down from Michigan so you could go to school in San Antonio. No one offered that to me. And so some of the things that he was trying to say to do, things I was doing, I was running. I have, Snapchat videos of me going on runs. I'd run 3 miles every once in a while, 5 days a week. And then I had to take days off. And, so I was taking steps, but they weren't really helping. The running helped me. It was always something that helped me. I was never depressed to the point I was suicidal, but it was always it was a coping thing. Just because I did cross country track and field through high school, and I got super serious about that. And I think I kept a lot of those habits with me, and they helped a lot. But after the medication, I wasn't able to do that stuff. It just sucks that happened too. It's just running don't feel the same. I don't feel the same endorphins I had. I don't feel the same pleasure from that. It's just, I still go for walks. I still want to stay active. I don't want to completely deteriorate and turn into a skeleton. But
I just want to say thank you so much for agreeing to let me have a chat with you. I think stories just like yours are really, really important, and it just helps to show what's happening out there. This is just a nightmare, and the hardest thing is you're not you're not alone. You know, it's happening like all over the place. And so thank you for contributing to this and getting your story out there.